Yes, and we're back in What's Up Doc, of course. Together with me is Dr. Ron Lau. And our topic is napaka-interesado.
Yes,
It's all about cosmetic dentistry.
And may hanging question tayo, Dr.
Oh,
Zenica?
about implants.
Yes. Ano ang hanging question is rate of, kunyari, rejection, possible complications,
yes,
rate of infection, mga
yes,
ganyan.
Yeah, Dr. Ferrer.
Positive, negative ng implants. Yung may mga criteria din yung implants kung sa patients namin. Like yung kung gaano katagal binunot na yung ipin. So there's a bone resorption. So problem with our clinic, pag yung patient dumating, matagal na siyang walang ipin, and we did some CT scan, sobrang nipis. So yun yung mahirap yung i-restore.
Pero there's still a possibility na pwede pa rin ma-restore in spite of a prolonged period of tooth extraction.
Pero mas mahirap lang on your part.
Yes. We need some, talagang kailangan yung patient is to be patient. Medyo matagal yung procedure kasi it takes time para yung ilalagay ng buto maging natural bone niya. And yung mga, another thing with the implant, when we put the implants in the patient, hindi siya maayos or hindi maganda yung oral hygiene niya, nagkakaroon ng implantitis.
Pero, implantitis. So, yes, inflammation of the implant.
Yes. Yung hindi masyado siya naglilinis at medyo napabayaan
niya. So, doon nagkakaroon ng problem, Dr. Ferrer, kapag medyo hindi poor compliant ng pasyente, doon nagkakaroon ng problem with the implants.
Kailangan may follow-up siya.
Yes.
How about diabetes? I mean, I can say it's a lot of cases of diabetes. Last time, ating guest si Dr. Torrijos, talagang diabetologist.
Stop diabetes.
Oh, stop diabetes.
Slogan natin doon. Yes.
And, yeah, I mean, when you gonna place the implant if the patient is diabetic?
As long as the patient heals and there's a maintenance, pwede siya. Yes, control dapat.
So, kinakailangan mo na ng clearance from a diabetologist?
No need. Basta as long as may control siya, maintenance niya. We done a lot of patients na diabetics. Okay naman siya. So far has okay siya.
Kanina, you're talking about cleaning. First muna, cleaning tayo, no? Kailan ba magpapaklining? Interval, once a month?
Ano ba yung talagang...
Oo, para sa mga ating television.
Mga bata,
i-cater na rin ng mga bata, no? According to the book, nung nag-aaral pa kami sa dental school, ang sabi nila, sabi ng libro, 2 years old pa lang ang bata, at least dinadala na sa pasyente, sa clinic.
2 years old?
2 years old pa lang. Okay, dinadala na ang bata sa dental office.
As early as 2 years?
As early as 2, minsan pa nga, baby pa lang dinadala na eh. Kasi yun yung tinatawag nating familiarization. Okay?
Familiarization.
We let our kid to familiarize with the dentist and the setup. Kasi ang nangyayari kasi nagkakaroon tayo ng fear of the unknown. Most of the time nagkakaroon na ang mga bata natatakot kasi hindi sila na-orient, walang orientation. Na as early na ganito pa lang edad ng bata kahit wala pang ngipin, then you try to swab yung gilagid, swabbing lang, yun ang basic talaga.
Kasi minsan may mga bata nakakita pa lang nakaputin, umiiyak na.
White coat syndrome.
White coat syndrome. So going to that, ang talagang normal na paglilinis ng ngipin natin is at least every 6 months. Every 6 months. Ngayon, mas maganda yon para ma-check natin kung merong nagbago o meron tayong kailangang ayusin pa. Hindi lang naman natin chine-check yung gums, chine-check din natin yung ngipin.
Okay? Pero pwede naman ito every month. Kunyari, may kapatid kang dentista, gusto mong...
Wala namang problema kung every month mo siyang
walang problema.
Walang problema.
Dentista, everyday, no?
Wala namang problema doon. Basta ang panuntunan natin, every 6 months you have to see her. Twice a year. Makita natin.
Tapos as early as 2 years old.
Kasi ang unang progression naman ng disease yung tinatawag na gingivitis eh. Okay? Yung gingivitis na tinatawag, yun yung pamamaga ng ating mga gilagid. Okay? Kaya nga itis. Ngayon, pagka sumobra na at nagkaroon ng bone resorption at saka pocket formation, yun yung tinatawag nating periodontitis. Okay? Ibig sabihin, yung ating gilagid at buto na suportado sa ngipin, merong pocket. Kumbaga, merong parang may may indent na nangyari at nagkaroon ng resorption na tinatawag.
Ayun.
Doon tayo nagkakaproblema.
Ayun.
Okay? Kaya nga sinasabi, pagka nagpa-implant tayo, tinitignan natin yung quality ng buto. Kung paano ba ito didikit sa ating ngipin, ay sa buto, yung tinatawag na osseointegration. Yun ang importante sa implant. Kung siya ba ay nag-osseointegrate at saka kumapit na at ready na siya to receive a restoration.
Okay. Now, when you had this kind of implants and then, of course, you eliminate all the complication, how long does the implant has to stay? I mean, is that for life or just you have to have
Permanent
like
or temporary?
temporary? You have to change every other year or every 5 years? Yes, Dr. Pierre?
According to sa article, mga medical articles, dental. After 10 years or 15 years, they will stay for good. As
Okay.
long as you do maintenance, check
ano may mga maintenance
10 to
naman?
15
Let's say,
years,
siyempre, iba yung
okay.
maintenance ng normal teeth and of course, maintenance
Yes,
ng
oo.
yeah.
Alam mo,
planted.
parang wala namang pinagkaiba to sa kotse. Yung tinatawag natin yung oil change. Ganon din ang implant. Pag wala naman talagang tinatawag na forever, no? Na ilalagay. Dahil talaga namang may mga do's and don'ts.
Yes.
Okay, pag nilagay ang implant, may tinatawag, kaya nga sinasabi natin every 6 months. Okay?
Okay.
Every 6 months. Ngayon, kung pakiramdam natin ang pasyente is hindi masyadong magaling ang kanyang hygiene technique, then we do the recall every 3 months.
Every
Okay?
3 months.
Ngayon, pag nililinis ang implant, ang ginagamit natin is plastic instrument. Okay?
Plastic.
Yes,
Hindi pwede
plastic.
mga metal.
Yes, kasi
special pala talaga.
ngayon, oo, may mga way din. Kaya nga sinasabi mo, another failure. Bakit nag-fail ang implant? May tinatawag tayong mga iatrogenic. Ano bang dahilan? Minsan ginamit na natin ng metal to metal. Kasi ang implant is titanium. Remember, it's a titanium.
Right.
So
It's an expensive metal.
Correct. So kung ginamitan natin ito ng isang instrument na habang nililinis, then it affects the
Baka
restoration.
humawa, no?
Diba?
Oh.
So kaya ngayon,
Yeah.
ang ginagawa ng mga dentista, alam na natin na once na pumunta ka sa isang dentist at nagpa-cleaning ka, sabihin mo, Doc, may implant ako.
Okay.
Or if you are a new patient at hindi ka patient of record, then you tell the
Ito ba, hindi ba
doctor
kaya
right
yung
away.
let's say, pumunta ka sa airport na mayroong metal detector,
Hindi
biglang
naman,
tutulog yung,
hindi naman.
Parehas
nga-
ba ng ano yan, bala?
Bala, oo.
Tanim bala. Mas maganda tanim implant.
Tanim implant.
Well, napakaganda ng topic natin. No? Yung kaninang ino-open ni Dr. Seneca, hygiene, yung halitosis na tinatawag or bad breath.
Oh, bad
Ano
breath,
ba ang
oo,
cause
isa sa-
nito and ano ba ang solusyon ng bad breath?
Okay, let's go back again to basic, okay?
Yes, yes.
Ang bad breath kasi maraming ways kung bakit natin nakukuha. Unang-una, kung meron tayong gum problem, okay?
Okay.
Hindi tayo nagtutoothbrush.
Right.
Meron tayong sirang ngipin.
Right.
Okay? Yung mga yon, once na we do the oral rehabilitation and oral check-up, yun ang mga factors to be considered. Okay. Ngayon, may mga pasyenteng medically compromised, okay? Yung iba, meron silang ulcer, meron silang problema sa intestine. Those are secondary. Okay. Nakukuha rin doon kasi pag huminga ka at direct na minsan umaamoy, okay? Pangalawa, we have to brush also our tongue and the surrounding structure.
Correct.
Kasi
Oo.
kung minsan,
Dapat talaga
brush
ako-
lang tayo,
Yes.
hindi natin binabrush yung
Yun
dila
yung
natin.
yung
Kailan
parang
dapat
madudugol
ako,
ka na.
I always do that. Kahit sa aking anak. I
Yun,
always,
yun, we
tell
brush
to
our tongue, we
the
brush our
tongue.
cheeks,
Yeah.
tapos we do the flossing and yung mouth rinsing. Okay?
Rosing, parang
Oh.
alam mo, doctor.
Kung minsan kasi
ipapakita
mahirap
sana
mag-floss
ako sa'yo.
di ba?
Ako, bata pa ako, may dala na ako nito.
May-
dental
Very
floss.
good
Yeah,
Doc.
yeah, yeah.
Magde-demo ba tayo? Magde-demo.
Kasi minsan nakakalimutan natin yung
I cannot
flossing.
live without it.
Yeah.
I
You know,
cannot
flossing
live
is
without the dental
another
floss. Yeah.
importante ito kasi we clean the interproximal area ng ngipin natin na hindi
Yeah.
na-reach ng toothbrush.
Eh, yung may bago ngayon, yung parang ganyang kahaba siya, may
Yung dental peak, yung
dental
dental peak.
Yeah,
oh.
yeah.
Ang dental
Is that
peak
also
naman,
advisable?
advisable siya pero may mga ways na pag maling gamit hindi rin maganda.
Yun. O, minsan nga pag napamali,
Oo.
napatuso ka na.
Kasi
nagbi-bleed.
hindi naman gagawin ng mga dental manufacturer kung hindi maganda eh. Pero ang kailangan lang we have the knowledge on how to use proper kung paano natin gamitin yung mga dental pick.
Ayun.
For example, mali lang ang pag-pick mo, pwede itong magkaroon ng abrasion sa surrounding structure, yung
Right.
gilagid mo masusugatan, masasaktan, even yung ngipin natin pwedeng ma-abrade. May mga ganung paraan. Kaya kung minsan, it's better to use dental floss.
We have some pictures of your before and after. Siguro
yes.
we could see that, and for for the benefit of our televiewers.
Yes.
How about that case? Paano
Yes.
nangyari yan?
Photoshop ba ito, Dr.
Ano yun?
Gian?
Parang pinotoshop.
Actually, all our patient may consent to. We're all consent. These are all consented patient na. Ang sabi ko na.
Ang
So
ganda.
this one, Dr. Gian, ano po ang ginawa dito?
Okay, this patient, I think she's from London, okay, and she wanted to have a very nice set of dentition, and she wanted to have it cosmetically done. So ang ginawa namin, we put veneers and crowns, and even we put one implant on her, just to do the function na, kasi may mga pasyente kasi they want instant. Okay,
Yes,
but there's no such thing as instant,
Okay.
okay? But
Coffee
with yes, coffee lang. And tsaka yung noodles.
Yes.
Okay? With this patient, so what I did is, I explained to her, when you're doing cosmetic, you have to explain to the patient like psychologically, economically, kasi you are putting a new smile,
Okay, right.
and new dentition. So mababago talaga. With this one, so we did a lot of laser treatment and cosmetic using all porcelain veneers and zirconium.
Wow. Yes, another picture, please. Ano mo, parang incredible, eh. O, parang
Yeah,
yan.
ito naman, this patient just underwent orthodontic treatment. It so happened may relapse. Kung mapapansin nyo sa baba, meron siyang siwang. Okay? So I said, do you want to do another orthodontia? Ayaw na. So I said, okay, we can close the gap. So we closed the gap on the bottom and we did whitening on the top. Okay, on the
And then,
upper.
when you say you close, you place braces on that?
Yes, nagkaroon ng relapse eh. Most of the time, pagka hindi sinusuot yung tinatawag nilang retainer, after the braces, bumabalik. So, patient compliance is number one.
Ako, nag-retainer ako kasi every night nga.
Yes. Napakaganda ng mga results.
Okay, so this is a great case. This is a great case, okay? Patient came to me, pumunta siya sa isang dentista, and they wanted to pull her upper teeth kasi if you can notice, wala na siyang height, okay? How would you put a upper denture on a lost height on the upper? So wala siyang tinatawag na vertical height, yung vertical dimension. So we did a lot of neuromuscular dentistry to restore the function and
When you
height.
say neuromuscular,
When you say neuromuscular, you respect the biologic, the muscles of facial mastication, and then the TMJ, the temporomandibular joint, the bone and the teeth. So tatlo. So this is a lot of things to do kasi we did a lot of tensing, yung transcutaneous electrical nerve stimulation, and then we put the patient in an interim restoration. Kumbaga, yung pustiso niya, 3 beses kami nagpalit. Kasi we're giving her a new bite, a new occlusion.
Is this a false teeth?
Yes, on the top. Top is a false teeth, tapos sa baba,
Doesn't look like a false teeth.
Yes, that's why we do cosmetic. Yan yung tawag na cosmetic. You restore the function and you restore the beauty of the patient na they wanted to enjoy.
So it's not only the functional but the aesthetic part.
Yes.
Now na nakita na natin yung mga picture nito.
Same thing with this one.
This one is also a...
This is a patient is a slightly crossbite. Nakita mo nakapasok yung taas niya sa baba. And he doesn't want to do any extraction at all. So but the teeth are badly broken. So what I did here is, we did some root canal therapy, okay? And then after that, nagkaroon kami ng konting laser surgery. Then we restore with all porcelain crowns. Okay? If you notice, meron siyang old crown na may black spot sa taas, yung dalawang central niya.
Yes.
Okay, because these are porcelain fused to metal restoration. Okay? So what we did, we used the all porcelain instead of using with metal.
All porcelain.
Okay, these are all porcelain para mawala na yung
Walang
shadowing.
implant na nilagay dyan?
Walang implant sa kanya kasi he's living from the States. So these patients came from, I think, from California.
Alam mo sa Amerika kasi napakamahal ng
Yes.
especially in that kind of procedure.
Talking about napakamahal, Dr. Seneca. Ito, favorite question ng mga Pilipino.
Yan.
Yes, oo.
Tatayan.
Magkano? Bigyan nyo kami ng range. Bigyan nyo kami ng range.
Yes, oo. More or less, ano lang, a gold bar.
Ballpark, yes. Ballpark lang.
I think Dr. Jules can answer.
Depending on the case.
Yes.
Kasi
Ballpark
sa implant, yung per
piece.
piece.
Pero in my clinic, we find a way para medyo mapamura. Like parang
Ang mahal.
individual, we make it reach to you're missing 4 teeth. We just put 2 implants. So
Implants. But what will happen with the other two teeth?
Ibibridge na lang.
Be bridge. Okay.
So magkano yun?
Implants,
Magkano,
implants.
Dr. Ferrer?
So yung implants would cost para depending on the patients and depending
Depending
Kunyari gusto niya yung magandang quality na.
Ganito
Kasi yan, Doc, okay? With dentistry kasi, we have jurisprudence regarding pricing and everything, okay? That's why, minsan nahirapan kami sumagot nun. Okay, I'll give you a scenario. Patient will call, okay? Doc, magkano po ang bunot? Magkano po ang papasta? Without seeing the patient, asking over the phone. And we cannot do that. And we cannot do that. Now we're in live television. With due respect with our colleagues in the profession kasi meron kaming pina-follow, okay? And we don't want to...
Bulong mo na lang sa amin.
Yes, ibubulong na lang namin.
Bubulong ko na rin mamaya sa kanila.
Kasi kanya-kanyang ano yun eh. Kasi we don't want to
understand.
prelude.
Ito ba halaga ba na isang cellphone lang o paano ba? Isang iPhone 6?
Bigyan ko na lang kayo.
Mas mahal
Siguro,
pa
mas
iPhone
mahal.
Mahal ang konti.
Mga dalawang iPhone 6.
Dalawang iPhone.
Dapat talaga nag-dentistry tayo,
Oo nga
Dr.
eh, dapat
Seneca.
oo.
Mali ang
Kasi bawat lugar kasi kung saan nagpa-practice ang isang dentista, meron silang panuntunan na nakaset. Okay? So it depends on the demographics where you
Correct.
practice.
Exactly.
Okay? So that's why we leave
Kumbaga
that
sa
question
coffee,
hand.
iba yung umuwi mo ng
Magaling
coffee sa
magaling
5-star hotel at saka doon sa...
nakaiwas ang mga ating mga doktor.
Galing, galing. Well, later on, we will be having our own, I could say, the celebrity guest, a very beautiful celebrity guest, and it will be a surprise. And we will be right back when What's Up Doc returns.
Natural look nose lift, cleavage by breast augmentation, curves by liposuction, non-surgical treatment of varicose veins, Janssen Cosmetic Surgery by Dr. John Seneca.